COVID-19 crisis has made clear that good health data can save lives. The pandemic underscored the vital importance of reliable and up-to-date information in the right place, at the right time, and to the right people. Comprehensive health data is a global public good. It allows us to learn from each other and focus on effective solutions. Partnerships such as the Health Data Collaborative are crucial. Partnerships like this help countries provide quality foundational data in a better way, which then again improves healthcare quality and health system performance. In the end, we can achieve more when we work together.
So Gavi is very focused in the next 5 years on reaching zero-dose children. Zero-dose children are those children who do not receive even a single dose of the most basic vaccine. And for us, those zero-dose children are markers of those communities that suffer from a lot of other deprivations. So mothers do not receive skilled birth attendance, antenatal care, contraception. These communities do not have often access to water, basic sanitation, nutrition, and therefore really bringing zero-dose children front and center of all Gavi efforts in the next 5 years, we are hoping would help us reach these communities, not only with immunization, but a range of other essential services. And as we pursue this quest to reach zero-dose children, data is going to play a very important role, because we need to first understand where the zero-dose children live and why they are zero-dose.
This year, particularly with the COVID pandemic that's affected every corner of the world, has really brought home to us how essential good data is as a tool for governments and for individuals to respond to a health crisis. And I think it's really illustrated how much we need data which is not just accurate, but also fast. If governments are going to respond to the pandemic and make policy in time that responds to the world as it is today, then they really need to have data which also can be absolutely up to date. This year's also, it's shown us how important data is. It's also revealed, I think, horribly, some of the huge inequalities and gaps that exist in data. So, for example, a vast majority of the world's population doesn't have their deaths registered. You know, we've all been sort of poring over the numbers of deaths and looking at and what the figures look like every day through the COVID pandemic. But most of the deaths that occur in the world are not registered. And that's just one example of where the huge gaps that we have in data are really going to limit the effectiveness of government in trying to tackle this and every other health challenge that they face.
If I'm responsible for managing a local or national response to COVID-19, I need information about who's affected by the disease, where they are, why they've been affected, and what needs to be done to help them out. The answers to these simple sounding questions of who, where, why, and what requires really good information, but to have that information, we need data. Data is numbers. Data is experiences. Data is anxieties and concerns. And we usually use the word data in the plural because it's a combination of multiple experiences, multiple quantifications. Without these data, our information will not be good enough to make the decisions that are so important for enabling populations to come through this pandemic in the best possible way.
There are recipe for a good partnership is really that every constituency understands their part and is willing to come and punch over their way to being a part of an alliance that actually then facilitates and enables them to do more together than alone. And so each constituency has a distinct part to play. The private sector, governments have a distinct, youth-led organizations are critical. So all the constituencies have their unique, ingredients in this recipe. And so you put it together. Partnership is all about you putting all of these ingredients together and getting something that's more of a global good and a change that is necessary.